Hey guys, I'm just going to make a quick video on wound packing, just a basic wound packing video real fast. It could be anything from you drive upon a car wreck, somebody has a wound right here, or an active shooter situation or whatever. Remember, when it comes to wound packing, if you can use a tourniquet first, I would say use a tourniquet to stop the bleeding. It's faster, it's more efficient. The legs, the arms, things like that, but there's certain areas of the body that you can't put a tourniquet on. The neck, there's a wound right here and he's bleeding out in the armpit, maybe the pelvic region, back here somewhere. You can't put a tourniquet if there's a giant gash right here or right here. So you need to pack it to stop the bleeding. If it's not bleeding, you don't really need to pack it. You can hold pressure, put a quick bandage on there. But if it's bleeding out, you need to stop the bleeding, just like the purpose of a tourniquet. So right here, there's a big hole. You can see I got 2 fingers in there. Let's say this was a gunshot. So this is going to be a basic one. I don't have a weapon on me. We're not doing, patient movement or anything. So the first thing you want to do is you want to apply pressure. You got to stop the bleeding. So I'm going to come right here. I'm going to put as much direct pressure as I can as I get my gauze out. And this is just a basic video. So let's just say I have some stuff in my pocket. I may even just use my knee real quick, without putting it on his throat, obviously, to just keep a little pressure there as I get my gauze. I'm going to unravel it. Try not to get it in the dirt, but that's not the priority right now. The priority is stopping the bleeding. So I'm going to make what they call a power ball. I'm going to make a little ball about the size of the entry wound right here. The first thing I'm going to do, I'm going to just start packing it. I put the ball in the hole, and while maintaining pressure, I just feed it through like this. I like to use my thumb and my fingers. So as I'm packing it, I'm keeping pressure, and I'm slowly packing the wound like this. What I was doing was, if this was real, I was feeling for that warm gush of blood. So that way I'm actually packing towards the source of the bleeding. So now it's packed. I can't really get any, as I was feeding it through, I can't get really any more in there. So let's just say this is all the way packed. What I would do is, I would take the remaining gauze and I would use this for a direct pressure setting, like this. Maintaining pressure, I'm going to take my bandage, and this is just a kind of a makeshift bandage here. And in this scenario, I'm going to put the bandage on, and I'm going to go under the opposite armpit. Maintaining pressure. I'm going to roll them over. I'm going to get it as tight as I can. This is all I have. It's not a Israeli bandage or anything like that. And that's kind of why I wanted to do this video. Sometimes you have to use what you have, even if it's an improvised way. And I'm going to secure it. clothespin. Now this is not exactly as tight as I'd want it to be because of this dummy, it's all awkward, but you got direct pressure. You got it, the wound is packed. You got direct pressure with the tightness pushing down on the pressure band, on the gauze, and it's wrapped around, not obstructing the airway. So remember, the basics, when you get the wound, you make the power ball, they call it a power ball, you shove that in the wound and you start slowly packing while maintaining pressure. You take the remaining gauze, you keep that on there, and then you wrap it. That way there's direct pressure on the gauze right here. And this would be tighter, but this isn't an actual bandage. I can go real tight and just smash it together. I had to just use this clothespin to keep it together. Obviously, I would make this super as tight as I can. I would have tied it into a knot and then secured it with the clothespin. I just wanted you to see on the dummy how you wrap it around the opposite side of the armpit. It's wrapped on top of the gauze. The gauze is inside the wound. So let's say the bleeding has stopped, and then you just remain this. You keep this on top of the wound. That way, as you tighten it, it's pressed down on the gauze for pressure. That way, if you have to reassess or drag the person somewhere, it'll stay. So what I would do in this scenario, say I had a cell phone, so EMS is coming. After I secured this onto the gauze, I would go ahead and put a little bit more pressure, and I would just keep this person as calm as possible. Check for exit wounds, check for other wounds, and I would make sure that they didn't go into shock. If I had to take my shirt off to keep them warm, I would, and of course I would make sure that they kept breathing. Always reassess the breathing. So I would stay here after I've already packed it. The bandage is tight. I would apply more pressure, and I would stay here with them if I didn't have to leave. In this scenario, especially because this isn't a really good bandage, I just had to kind of tie it together, as you see. You have to. That's why I brought this out there. You have to use what you have. This would work if I maintain pressure. The wound is packed. This is, it's not tight, but you get the idea. I would have just really cinched it down really good. I just want to hurry up and show you how you can put it around the opposite side. But if I just sit here, it's already packed, and maintain pressure, the bleeding would stop, and I could hold here until help arrived. If I have to keep pressure on this gauze, take the bandage off and do it and re-tighten it, I can't. That would be fine. But let's say I didn't have this, I could take my shirt off and cut pieces of my shirt off to pack the wound. So that's another thing that you can use if you don't have anything. Just stop the bleeding. That's direct pressure. Packing the wound is the basic idea of this. So this would be a spot on the body. You can't put a tourniquet on there. So that's how you would pack the wound.